I'm Kathleen Bettinger. My background is from Minnesota, if you look at my bio, but I've been in New Mexico for 6 years now, worked with Sandoval County during my program at UNM as a graduate student. Thank you for inviting me to testify today. I appreciate it. And Mr. Chairman and committee, thank you. I do want to make this really clear to begin with, is that I am an instructor, dental hygiene instructor at DACC. I'm an assistant professor and I'm now interim program director. I want to make it very clear that I am not speaking on behalf of DACC and I'm not speaking on behalf of NMDHA, the Dental Hygiene Association. I'm speaking as a single person. So I was very happy to be invited to go up to Alaska to visit the students in the program at Anchorage and Bethel. It was, I had some kind of questions in my mind as an educator, what takes place in this program. I'd heard so much about it, but I wanted to see it first, eyewitnessed here myself. And I was really impressed. And I want to share some of my thoughts with you about the program there. To tell you a little bit about the students, they come from communities that have mentored them. A lot of them have been dental assistants. They had to have family members who were nurses or health aides. And so they had some mentorship and had some sort of an idea of how those people were looked at in their communities and how they could be leaders. And so in interviewing them and discussing part of this, why are you here? What type of commitment do you feel? They feel very strong connections to their people and that commitment to wanting to make a difference for their people. And so some of them had some very poignant experiences in witnessing what they had seen growing up in the villages. It was typical to go to school as a kindergartner and see, their fellow students missing their 4 front teeth, or what they had princess crowns or prince crowns, all of their teeth with stainless steel crowns. They had really good comments about the dentists that had come to their communities and come to their villages from time to time. But the only thing was, is they said, we didn't see the same one twice. So not making that connection, and I don't know how difficult it is for some of you to change dentists. It's probably easier to change your physician, but you become familiar with your caregiver. So that was part of their concern too, is not having that continuous care. So they witnessed rampant decay, like I said, amongst their classmates and their peers. So the way that the program works there is that there's huge sponsorship from their communities. Most of the students are sponsored through their foundations, and then a lot of collaborations of those entities and those founding associations. The coursework, I was really impressed. I know with my students, and you always encourage them to read ahead, study hard, but this was at a different level. They would oftentimes, they're starting school at 6 o'clock in the morning, and then they're going through a full course of lecture or clinic, followed by evening reading. Now these students are removed from their villages. They come into Anchorage or they come into Bethel. The first year is in Anchorage. They leave their babies behind. They leave their families behind. This is their life, and it's very concentrated. I can't tell you how much, what they put into their days. The subjects are taught in a linear fashion, so they build on that previous knowledge. It's not a course in biology here and anatomy there, but it's very linear, very structured in that fashion. It's also competency-based. The students are required to meet that subject knowledge and the skill requirements necessary to do that task, perform that without being able to go, I mean, they're not able to go on to the next step. So very much based on their skills, being able to move ahead. The time and effort, talking about the amount of time in the classroom. So it's not just the amount of time in the classroom, but the amount of time that they are spending on learning. So they're acquiring a full scope of knowledge necessary to provide the care within that scope of practice. And there are no shortcuts with this. It's very tight, very, very concentrated. They do receive extensive clinical experience. They start serving their communities right away. We were there at the beginning of the semester. So they were seeing in Anchorage as first-year students doing the motivational interviewing. A lot of times, it's very scary to go out. You go into a dental office and you're just taken back in the back room. They do things right there in the waiting room. They play with the children. A lot of times the exam takes place there. It's a very, very different model. It's very friendly. It's not intimidating. And I was really impressed with it. I want to say, too, I was very impressed by the students. I don't know who I thought I was going to appear, kind of some bumbling people that couldn't speak or whatever. They were very sophisticated. I was so, so impressed. And I think that's from the confidence that they have, that they bring from their villages. It's the inner confidence that they feel as they're moving forward, and they're going to be leaders in their communities. So overall presence was just fantastic. Let's talk about the supervision a little bit. And this is the question that I really had. How can a dentist supervise the therapists? How does this work? So this was a big focus of mine when I was there. So the layers of supervision on both the dentists and the students. The dentists are supervised also within a peer group. These aren't dentists that are just coming out of school that don't have some training also. That's very, very important, is to train the dentist that's going to be working with the dental therapist. I see that as a two-part thing. Building that team model, it's a symbiotic relationship between the dentist and the DDS. And I agree with Pamela, you don't have the DDS without the dental therapist, or vice versa in this type of model. It's general supervision, and it's strictly adhered to through the telephone and the internet. Under this general supervision, the dental therapist works under what's called standing orders. They can only do as much or as thorough those procedures as that dentist feels that they're able to do. It's monitored heavily. They're not able to do any more than that dentist feels that they can do. They may not be doing extractions until they're 3 years out of school, whatever that takes. And they were very clear about that. It's very supervised, even though they're not working room to room next to each other. The facilities were very modern, accessible to the community. Talked a little bit about the waiting room and how welcoming that was for the patients. It didn't seem to be scary at all. And there again, it's people that look like them. These are, that could be their auntie or the tia or whatever. So that was really, I think, a different situation that Doctor came up with that too. The staff, some of the permanent staff that are there are so dedicated. They're dedicated to the program, they're dedicated to the students, to the community, and I just can't say enough good things about them. Some of you have met Mary Willard and some of the other staff. They're fantastic. So they're using their experience and the judgment, decision-making for the rest of the team. The supervising dentists are brought into the program from various other states. They're recruited. They're usually serving various times in that role, wanting to know more about the program, expanding their horizons. They do rotate through the program and then go back into the lower 48, most of them. Some are hooked and stay forever. The dental therapists then go back to their communities. They do stay there. It's a friendly face that those people in the village, young and old, can connect with and not be as fearful, and they get the care that they need from that. So the dental therapists, I see them as bridging the gap between the dentist and the community. So what do we have for New Mexico? How do I see this working as an educator and a part of this process for a long time now, actually since I came to the state? So in New Mexico, we know that the need is here. We've established that. It's very clear from all of us that have presented or testified today that that's true. So, and I feel like we're not very far from really developing this solution for this big, huge problem that we have. I think we're really close. I think we need to work together. I think we need to be open-minded. I think we have to ask a lot of questions of each other. And I think we'll come up with the solutions. So I see the R.D.H. curriculum, the dental hygiene curriculum that I'm part of. I see that it closely mirrors that of a dental therapist. When I looked at the curriculum in Alaska, I saw that it was really so close to what we're teaching right now. And I think that, you know, within 6 months of really concentrated training, not the program that we have or we see in general in the college, but something that's really more like the dental therapists in Anchorage and Bethel, that very, very long days, very concentrated with that. But I see that there's a possibility, and also that training for the dentist is a necessity, and I see that, you know, if we can bring our different factions together and our educational components, that we could do that. So, thank you.